morning, and thank you for tuning in to 313 News. Today we turn our focus on a public service announcement, which we hope will help educate you in this frightening time. There has been a rising number of patient cases involving this genetic disorder across America. Doctors are trying to raise awareness of what this genetic mutation is, how it is inherited, and what you can do if you have hemophilia.
So what is hemophilia? Hemophilia is a blood clotting genetic disease. A person with this disease lacks sufficient blood clotting proteins called clotting factors. This can cause an infected person to have complications with even the smallest cuts or bruises. Hemophilia was first documented in an article published by John Conrad. He recognized it as a genetic disorder than which men were mainly affected. Originally called hemophilia, later researchers shortened the term to hemophilia in 1828. Research of hemophilia continued into 1947 when Dr. Alfredo Pawlowski discovered there were 3 types of hemophilia, A, B, and C. The rise we are seeing in hemophilia patients is believed to be because of the increase in the number of carriers breeding with each other. As of now, it is estimated that about 20,000 individuals are living with hemophilia in the U.S. alone, affecting 1 in 5,000 male births. Worldwide, it is estimated that 1 in every 10,000 births are affected with hemophilia A, and every 1 in 50,000 births is affected with hemophilia B.
We have been able to get someone today that has been living the past 23 years affected by hemophilia type C. Good morning, Michael.
Good morning. As you've said, I've lived my life with hemophilia C, which is the more severe form of hemophilia. In cases like mine, the symptoms are pretty obvious even from a young age. Type C patients have a severe degree of reduction in their clotting factor. I have severe bleeding from even the smallest injuries such as a cut, scrape, or bruise. These little things for most people wouldn't be a problem, but for me they're an emergency. My disorder will even cause spontaneous bleeding that I need to always be aware of, and it practically makes any surgery or procedure impossible for me because of the degree of trauma from even the smallest procedure. Someone that has type A or B can also vary in severity of the condition, but also need to be aware of the types of injuries, even if the reaction isn't as severe as mine. If you're worried your children might have hemophilia, the early years are the best to catch it. Signs such as excessive bleeding after circumcision, or by noticing bleeding or bruising from minor injuries later in life. Despite not having a permanent solution for those of us living with hemophilia, we can still live a fairly normal life. There's treatments and precautions that are available. For most cases of hemophilia A and B, it's necessary to have regular injections of hormone desmopressin to help release more clotting factor into our blood. For someone with a moderate or severe case of A or B, management of minor bleeding with injections and first aid techniques will most likely suffice. If bleeding continues, a person may require infusions of clotting factor from a donor. Unfortunately, for someone like me that has hemophilia C, I require plasma infusions to stop bleeding along with many of the techniques used for A and B. We can be proactive though. Anyone with hemophilia should get hormone desmopressin and take clot-preventing medications that will help the clot from breaking down and promote healing. But most importantly, no matter the injury, first aid needs to be applied immediately by applying pressure along with the bandage and apply topical clot-promoting medications if available.
Thank you, Michael, for that great first-hand information. From what doctors are saying, hemophilia's type A and B are an X-linked recessive genetic disorder caused by a gene located on the X chromosome. This means most carrier mothers pass it on to their sons. Women can be affected, but it would require an affected chromosome from each of their parents, or obtain one affected X chromosome while the other is missing or inactive. Hemophilia type C can be inherited from either parent and is capable of affecting both males and females. Most women with the defective gene are carriers but experience no signs or symptoms of hemophilia. With this rise in cases, hemophilia is a disorder people need to be aware of. This is why doctors are recommending that potential parents get tested to see if they are carriers, especially if they have a history of hemophilia in the family. This way, parents can be prepared early on to handle and take action to ensure that their child is well taken care of.
In the 1900s, the life expectancy of a treated individual was about 13 years of age. Chances of complications increase as a person ages. Today, an effective person can live a full life if this genetic disease is caught early and treated. Thank you so much for turning to 313 News. Stay informed and have a great day.
Yeah, this one right here goes out to all the babies, mamas.